Hello everyone. Today, we're exploring the medication known as Xarelto, with its generic name being rivaroxaban. As always, this discussion is for educational purposes. If you have health-related questions or concerns, it's essential to consult a medical professional. Description: Xarelto, or rivaroxaban, is a member of the factor XA inhibitors class of medications. Its primary mechanism of action is to block a specific natural substance that aids in the formation of blood clots. Xarelto is prescribed to treat or prevent blood clots, which can manifest in the legs, known as deep vein thrombosis or DVT, or the lungs, referred to as pulmonary embolism or PE. Additionally, this medication is used to help prevent strokes or severe blood clots in adults with atrial fibrillation not caused by heart valve disease. It's also prescribed for adults undergoing hip or knee replacement surgery, those hospitalized for grave illnesses at risk of clot formation, and in conjunction with aspirin to reduce the risk of heart attack, stroke, or death in adults with coronary artery disease or peripheral arterial disease. Furthermore, Xarelto is used to treat and prevent DVT and PE recurrence in children and specific infants who have undergone at least 5 days of initial anticoagulation treatment. It's also utilized post-heart surgery in children aged 2 or older with congenital heart disease. Warnings: it's crucial not to stop taking Xarelto without consulting your doctor, as doing so can elevate your risk of blood clots or stroke. Some medications can heighten your bleeding risk when taken with Xarelto. Immediate medical attention is required if you or your child exhibit signs of bleeding, such as persistent headaches, extreme weakness or dizziness, bleeding gums, nosebleeds, or any unceasing bleeding. Xarelto can also induce a severe blood clot around your spinal cord if you undergo a spinal tap or receive spinal anesthesia. It's not recommended for those with an artificial heart valve. Before taking this medicine, ensure you're not allergic to rivaroxaban or any ingredients in Xarelto tablets. Given its impact on bleeding, those with active or uncontrolled bleeding should avoid it. It's essential to inform your healthcare provider of any history of spinal problems, surgeries, bleeding issues, artificial heart valves, liver or kidney diseases, and any other relevant medical conditions. Side effects: like all medications, Xarelto can have side effects. Some individuals might experience excessive bleeding, vomiting, cough, or stomach inflammation. It's vital to be vigilant of these potential side effects and consult your doctor if you notice any unusual symptoms. Interactions: Xarelto can interact with other medications, so always inform your doctor about all medications, supplements, and herbal products you're currently using. Dosage: always follow your doctor's recommendations when taking Xarelto. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Avoid: while on Xarelto, it's advisable to steer clear of activities that might increase your risk of bleeding or injury. Extra caution is recommended while shaving or brushing your teeth. FAQ: a common question about Xarelto is its interaction with other drugs. It's essential to know that many drugs can affect rivaroxaban, especially ketoconazole, ritonavir, erythromycin, rifampin, and NSAIDs, among others. Closing: that concludes our overview of Xarelto. Remember, this information is for educational purposes and should never replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.